providing resources and comfort to caregivers. This is Caregiver Crossing.
Good morning. Welcome to Caregiver Crossing. Thanks for being here. And if this is your first time joining us, you should probably know that Caregiver Crossing is a show brought to you by Joyce House. And we're presented in partnership with Cardon and Associates. And we're right here with you every week to discuss all things caregiving. I am your host, Tina McIntosh. I'm in studio with
Noah Taylor.
And we're glad to be here. Terry Stacy, as many of you can understand, is taking a little bit of a break. The woman puts about 4 months of work into the month of May. And so she's breathing right now. Hopefully not even listening.
Yes. Hopefully she's having a lot of fun.
That's right. So, Noah, you recently did something that was really related caregiver that I don't think you've ever done before.
I have not. Actually working at Joyce House, there's been a lot of things that have been first times for me. But this one was really fun. We got to go, myself specifically got to go to a memory cafe hosted by the dementia-friendly Indianapolis Action Team.
Oh, the Memory Cafe. Had you even heard of such a thing before?
I have never heard of it before I started working at Joyce House. I've never heard of a memory cafe.
So for somebody who has never been to one, explain to them, what is a memory cafe?
So a memory cafe, how they define it, is a safe and social outing for a person living with dementia and any of their loved ones too. It's really just a safe event for them to come together and have a great time.
But like what? Like you walk in the room. Where was it held?
This one was held at a church.
Okay. And you walk in the room at the church. And is it like a social, everybody's talking to everyone, or is there structure? Like, what's it feel like in the room?
There was some structure. The people, the dementia-friendly Indianapolis team were there to sort of facilitate some of the conversations, but a lot of it was really just a social gathering for these people to come together.
Yeah. You know, we've talked on the show before about the fact that, oh goodness, it was the state of aging report that we had in Indiana in 2023. And I can't remember all the details, but of the people who responded, it was like 30 or 40% of caregivers responding to this said that they had thought about suicide in the last 30 days. And we've talked about it here before because it shakes me to my core, you know, of that statistic. But when you think about it, it's because caregivers, there are a lot of reasons, one of which is feel isolated and lonely. Like they feel like they're the only person
going through this.
Right?
Yeah.
And I get it. I mean, I've been there.
To feel like that. It is.
And so a thing like a memory cafe is so good for folks to know. People can't understand your exact journey because it's your life, right? It's like understanding your brain. It's yours, but that there are other people going through things that are similar. So I'm glad you went.
Yeah, I'm glad too. This one was really special because they had a drum circle, which was really fun.
Oh, that is cool.
It was really cool.
Have you done a drum circle before?
Actually, yeah, in elementary school, I did do a drum circle, but not anything like this. This was really fun.
Yeah. And, you know, for someone living with a dementia or another diagnosis, a lot of times that rhythm can soothe people, right? Mm-hmm. And help them. Do you remember who did the drum circle?
I can't remember
That's
the name
okay.
right now.
Was it our friends at Bongo Boys by chance?
It was not Bongo Boys.
Oh, I love Bongo Boys.
I love Bongo Boys too.
If you haven't been, check them out on the north side of town. They're just fantastic. But I remember when my son, who's now 19, we struggled when he was younger, just trying to figure out exactly, I mean, like anybody, not, you know, who he was, basically,
yeah.
like, right. What really got him excited about things. And I remember we went to Bongo Boys for a drum circle. They used to do them on Thursday nights and it was free to the public. And I don't know if they still do that or not, but we took him and he was maybe, I'm going to put him at the age of 6, just for kicks. His name is Webb. And I remember seeing Webb on the drums and his body started moving, his shoulders, his hips, like
getting into the groove.
Dude, his soul came alive. I mean, I remember sitting there watching him in that drum circle with just tears streaming down my face because it was the first time in a long time I felt like I looked at him and I was like, oh, I see a part of your soul.
That's so incredible that especially that music can do that to us. It makes us feel so many different things.
It's so cool. I'm so glad you did that.
I am too.
Speaking of unique experiences, we've got one coming up And we should also say, by the way, that memory cafes are usually free.
Yes, this one was free.
Okay, but you do need to probably sign up, on the website. So go to dementiafriendsindiana.org and you can see where they are close to you and make sure that they're free or, something that you can afford.
And they also do options virtually too if you're unable to make it out of the house.
Oh, I didn't know that.
Yeah, probably something that has been implemented pretty recently, but yeah, it's a really cool option.
I'm telling you what, COVID really opened up a lot for us in some really good ways. I mean, I know I'm going to probably get some pushback on that, but really, I mean, it let us into how we can do things a little bit differently, which is really cool. We have our open house coming up at Joy's house on June 12th. And so we want to make sure all of you have it on your calendar. Come, show up, grab us gently. I mean, with love. But, just say, hey, Noah, hey, Tina, hey, Terry, I listen to the show and this is why I listen, because we want to hear from you. But we would love to meet you in person. June 12th is our open house at our Broad Ripple location for Joy's house. And I believe it starts at 5:30 to 7:30.
Yes, that's correct.
I mean, if you need some enticement, there will be some food and beverage. There's, of course, great company because our coworkers are fantastic and our families here. And there will be miniature horses.
And we'll have some therapy dogs there. And you'll get to be able to sample some of our guest activities too, which will be really exciting.
It's going to be a good night. It always is. And so that is our open house coming up in Broad Ripple. You do not need to RSVP. You just need to show up, pay attention to parking. We'll have people helping you with parking. And we usually have a little bit of a shuttle running too. So what else? What else is going on with you? Anything good?
Anything good? I got to see a soccer game, FC Cincy play over the weekend.
How was it?
That was really cool. I love them. I graduated from Cincinnati, so I get to go back pretty often. And I love it. It's a lot like Indianapolis. Cincinnati does feel like that. Feels like home.
It's got a good feel to it.
Yes.
That's on our bucket list of things to do this year is to go to the Indy 11 games. I haven't been yet.
They're so much fun.
That's what I hear.
They're so much fun. I'm a big fan of soccer, though, so I might be a little biased.
Yeah, and soccer players, soccer fans, seem to be kind of rowdy.
Absolutely. They can be quite rambunctious.
What is that all about?
I don't know. I think they just love the sport. They get so into it.
But I feel like football players love the sport, or baseball players love the sport, or field hockey. But yeah, soccer, I don't know. It's like whole next level stuff. Well, we're going to have to take a break here in just a moment, but would like to encourage you to, again, put the open house June 12th on your calendar. So stick around. We'll be back in just a moment. You're listening to Caregiver Crossing, a show designed for family caregivers and people who love them. Caregiver Crossing is brought to you as a service of Joy's House in partnership with Cardon and Associates. With locations in Broad Ripple and near the University of Indianapolis campus, Joy's House provides exceptional day services for individuals living with life-altering diagnoses and compassionate support for family caregivers throughout the community. At Joy's House, we believe that everyone deserves to live their best life, regardless of their abilities. And you can learn more about our adult day and caregiver support services by calling us at 317-254-0828 or by visiting joyshouse.org today. That web address again is joyshouse.org. And if you'll stick around, we'll be right back with more Caregiver Crossing right after this. Welcome back to Caregiver Crossing. We are your hosts, Tina McIntosh and Noah Taylor. Thanks for sticking around with us. And today on the show, we have someone who I don't know that I could have any more respect for her than I do. And I mean that as a compliment, even though that might have come out kind of weird. But Dr. Nicole Fowler is with us. So I'm going to pause, say hello to you, and then I'm going to give your credentials. Hi.
Hi, everybody. Thank you so much for having me. This is an encore for me. This is my second time on Caregiver Crossing.
Well, and really, we could probably have you on every, month and keep you all day long. So you are, make sure I get this right, Director of Research at the Division of General Internal Medicine and Geriatrics at Indiana University School of Medicine and an Associate Professor of Medicine.
That's correct.
What does that mean?
Well, that means that I do my research at IU School of Medicine, and I help other people in internal medicine and geriatrics do their research too.
Oh, that was really nice and easy. Like that, I got that.
Okay.
And your research area, and we've known each other for years, and really I'm like waiting for the thing, right, that we're going to do together, and it's going to be incredible and change lives. And so you really have a heart for family caregivers.
Yeah, I think that my work from the very beginning has always thought about older adults as being part of a family that cares about their well-being. And so it's really hard sometimes to think about how to improve the life of older adults without thinking about the family around them.
I mean, I would almost say impossible, right? There's so much to the family caregivers. And so one of the questions we get all of the time, and I'm having in my own life with someone that I love right now, is how can caregivers differentiate between normal age-related forgetfulness, so just normal aging stuff, and concerns about dementia?
Okay. I also get this a lot. And we get it in the clinic, we get it at home. I think one of the things in particular is we think about, our body is evolving and aging every single day. Our brain is part of that. And so just as our heart ages, our brain ages. So it is true that there are changes that occur over time for two people's brains as they age. I think one of the things that we try to differentiate the most about is it interfering with their daily living? Is it changing their ability to do something that they either were able to do pretty easily a week or two ago or a month or so ago? And is it also out of ordinary for them? So I think that sometimes we'll say, they've never been good at directions. Okay. But you know what? They used to be really good at, doing all the finances. And now this just is not something they're able to do. I'm noticing that there's bills that aren't being paid or, things that are being turned off because of not being able to pay attention to the bills. So I think that's oftentimes what we sort of help differentiate. And the testing that we do actually does try to take into account too what we might consider standard and normal changes for people as they age on things like memory and executive functioning compared to what might be outside of the normal range. So oftentimes when people come and we do some testing, we are able to adjust for what we think would be a normal aging process versus abnormal aging process. And
that's hard. I mean, that's hard, right? It's hard to diagnose that with your parent or your loved one at home too. I've caught myself before saying to somebody who says, like, I came in the room, I came in the room. I can't remember why I came in the room. And I've caught myself saying, if you didn't know that you came in the room and forgot why you came in the room, then that's next level.
Yeah.
Like, you forgot why you came in the room.
Yeah. I think sometimes people say, I forgot where I put my keys. Well, that's okay. I mean, we forget where we put all kinds of things. But if you forget what your keys are for,
right,
that's when we need to be a little bit concerned. And I think, too, that's why I really do encourage, I think, because I get this question so often, especially, from family members, adult children, it's really important, too, to get a baseline. I think that, we get a lot of different types of preventive or, baseline lab work about our cholesterol and our blood pressure. And it's really great to get a baseline on how your brain is, especially if you're older and, maybe getting an annual checkup is really important.
It makes me want to go do it now. I have that brain tumor in there. Do you know that? I've got that meningioma in there. And I'm like, maybe it's time for a baseline for me, just to be smart down the road. But I think when you say that, you really are talking an aging adult. I'm 52, but
correct.
Typically someone who's aging or seems to be showing signs maybe.
That's right.
What are some of those common early warning signs of dementia that people can be looking out for?
Mm-hmm. Well, I think some of the things that we would maybe look out for in the earliest stages is, changes in behavior, such as sort of appearing to be more apathetic, maybe not necessarily paying attention to the conversation. And this is also when we start to tease out things like, is it a hearing issue? Is it something else that's going on? That's why it's really important to get a baseline, because it may not just be memory or executive functioning. It could be hearing. It could be some other kind of sensory. So I think looking out for things that definitely appear to be different compared to how they were a year ago or sort of historically what you've known.
Okay, so that makes me think about, and by the way, you're hearing the voice of Dr. Nicole Fowler. She is everything wonderful. So it makes me think about the importance of primary care and going to your doctor. One, letting your primary care doctor know you as a patient, so they can see any of those changes. But I don't know that they always do a really good job of teasing those things out.
Yeah. Well, I think sometimes, the first thing to know is that most of us will never have an opportunity to see a specialist. It's really one of the things I think a lot about because most of my work happens in the primary care setting or home and community-based setting. We're here and we're lucky in Indianapolis. We've got access to great specialists in neurology and geriatrics and palliative care. But if you live in a place where you don't have that, your primary care provider is your doctor.
That is a great point.
Yeah.
I mean, that's a great point. I have a slew of specialists with my health issues in the past. And I cannot, when you said that, I was thinking, what? Like, I can't imagine, but you're right. It depends on where you are.
Yeah. And, so a lot of times when we talk about, who is the appropriate person for you to bring up this kind of issue with, primary care is the perfect place to start. One is because oftentimes, they have a longitudinal relationship with you or they want to, right? It's somebody that you see more than just once for an acute issue. It's somebody that you see maybe once a year, maybe once every 6 months. And so I think they're the best person to kind of bring that up if you have concerns, whether you're a family member or whether you're a patient. And I think there's a lot more primary care providers now who are actually recognizing that it's something they should be asking about.
Well, which is great because we don't have enough geriatricians.
That's right.
I mean, so, thank goodness that is what you're saying and what I'm hearing. And okay, so are there anything that caregivers or individuals can do at home to kind of test? I mean, I know there's the whole, remember these 3 words and ask someone again in a few minutes. Is there anything they can be doing or should they just leave that to the professionals?
Yeah, well, I think, first of all, I would never sort of advise an adult daughter to try to, pull out a neuropsychological exam and do it on a parent, because I'm sure that won't make for a really nice, fun Sunday dinner. But what you could do is you could ask your parent, do you notice anything? Do you notice anything that's changing? Do you have any concerns about your memory or thinking? Do you think maybe, my brother, do you think Tom, do you think he would actually have any,
It's funny you say
concerns?
that. And I'm like, how many of us don't do that?
Right.
Just don't have the conversation.
It's oftentimes just kind of asking, I think, too, and not in a way that feels, of course, threatening, but just in a way that's sort of, do they have any concerns? Because I think sometimes, most of us may have a concern, but until we get asked about it, we won't bring it up. And so just by opening up the door and saying, do you have any concerns? I was listening to Caregiver Crossing or I was watching the NBC News and I just was curious, do you ever have any concerns about your memory? Just starting the conversation and then maybe inviting them to talk with a provider and asking if you can go along.
I love it. Name it, have the conversation. You don't have to pressure, right? And asking to go along, I think, is critical too. It's hard when we send someone to a medical professional by themselves, particularly to talk about something that might be dementia related. So I know we're going to take a break. Dr. Nicole Fowler is going to stick around with us and don't go anywhere. We'll be back in just a moment on Caregiver Crossing.
You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you by Joyce House in partnership with Cardon & Associates. With 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living experience, Cardon & Associates provides residents with the best senior living options and personalized service. Visit cardon.us for more information and to find a community near you. Stay put, we'll be right back with more Caregiver Crossing after the break.
We're back on Caregiver Crossing, and I'm your host, Tina McIntosh, here with our producer and co-host, Noah Taylor. Hey, Noah.
Hey, how's it going?
I swear he's sitting here, even though I love Nicole Fowler, Dr. Nicole Fowler, and she is still here. And we've been talking about caregiving, a lot of the work that she does as Director of Research for the Division of Internal Medicine and Geriatrics. And then there is something really big coming that's called the guide model. And we need your help to understand it.
Sure.
You feel equipped? Are you ready?
I'm ready.
So in very simple terms, like I'm second grade and I want to understand what this guide model is that I keep hearing about. It has something to do with Medicare.
That's correct.
What does that mean?
So let me start because I'm sure your audience is well aware if they're caring for somebody a family member or friend who has dementia, oftentimes what they need is not what Medicare provides. And many people have been talking to Medicare over the past 20 years about the fact that there's a lot of people living with Alzheimer's disease and another form of dementia, may even be from Parkinson's disease or some other neurodegeneration, and they're not getting what they need. They need caregiver education and support. They need care management to help them make connections between their specialists and their PCP. They need information about how to get things like Joy's House and Area Agency on Aging, home and community-based services, and that's really hard for them to get. And so over the past 20 years, there's been lots of data that providing these types of services to people living with dementia and their family members really does improve outcomes. It improves patients' ability to stay at home longer, behavioral and psychological symptoms, meaning that they're not as, agitated, family caregivers feel they have support and are less stressed. And these are the kinds of things that aren't frequently paid for. There are places across the country that have been doing this either through research money or through philanthropy, but it's not accessible to everybody. And
not maybe the best model to sustain going forward.
That's correct. Yeah. And so there was a lot of discussion with Medicare back in late 2019, early 2020, when something was ready to get started. And if you may imagine, something else happened that derailed a lot of the healthcare plans that the federal government had. So COVID really delayed the ability for Medicare to take a look at all of the evidence that's been generated over the past 20 years, some of it right here in Indiana, and other places like our partners in San Francisco or UCLA or Johns Hopkins have also been developing this evidence base. And so finally, in late 2023, or it's actually summer of 2023, I think Medicare announced the fact that they were now going to be offering providers, so mainly these are health systems that deliver care to people. They could either be a physician's practice or a health system, that they were going to allow them to apply to Medicare and describe the type of program that they would put together based on the data that's been presented by us folks in Indiana and other places about how best to care for people, maybe with their own spin. Maybe they, care for a lot lot who speak
they like
Spanish.
Innovation. I mean,
exactly.
Even with the evidence-based, they like the innovation.
Yeah. Well, and they recognize they wanted to be, culturally appropriate and tailored to the community. So people were allowed to submit applications to say, hey, we have a program. Here's what our program looks like. Are you willing to accept us as a participant? Or we think we can put together a program. Here's what we think we would do. Would you accept this? So all of those applications were due in January. And in April of this year, of 2024, places across the country were notified if they were asked to participate. So we are lucky enough to have 3 participating here in the state of Indiana. So Eskenazi Health will start in July of 2024. IU Health will start in July of 2025, as will Aging and In-Home Services of Northeast Indiana and Fort Wayne will also start in July of 2025. And this is a great opportunity. This is open to every Medicare beneficiary who has Medicare fee-for-service. So unfortunately, if you're enrolled in a Medicare Advantage plan, this wouldn't be an option for you, but this would be Medicare fee-for-service who are living in the community, have not decided to opt for PACE or hospice, and they can actually find a provider who is delivering this service, and they don't even need to change their own doctor. So, for example, you just heard me say IU Health, but if you get your primary care from St. Vincent, that's fine. You can continue to get your primary care from St. Vincent, but align with the IU Health Guide program. It doesn't allow people to make choices or restrict to what they've already been giving.
Which is really key for people as they're aging, and particularly living with dementia,
Absolutely.
Right? History, trust, all of the things. And then if I'm participating in this, so I meet the qualifications and I'm participating in the guide program, what do I get? What's the benefit? Let's say that my husband has dementia and I'm his caregiver. What's the benefit to my family?
Yeah. So I will say that it's specifically designed both for the beneficiary and for their caregiver.
Brilliant.
And their caregiver does not have to be a Medicare beneficiary. So the other thing that makes this really innovative is in the past, Medicare's really just focused on the beneficiary. And in this case, they recognize that there's lots of people who provide care who are not Medicare beneficiaries. And so what you would get is a special care navigation service. And in the guide model, they're calling them dementia care navigators. And that dementia care navigator would be somebody who checks in on you on a frequent basis, may do a home visit, find out some of the things that you in particular need, some of the things that maybe you want to learn more about, and put together a care plan with other people on the team. So the other people on the team, of course, include the family, but they also include maybe nurses or social workers, and of course, physicians who will serve as the medical director for the program. And then they help coordinate that care. So if you say, you know what, I really think I need 2 days a week where I can go and do my shopping and, spend some time to myself. I need 2 days of respite care. Then the guide model would figure out what are some of the resources in your area for you to be able to get those 2 days of respite care.
This sounds like the best of every world. I don't have to change our providers, and I'm basically getting a person who is my contact who will act as a social worker, a connector, a medical listening ear, like all these things, and help me with things I don't even know that I necessarily need.
That's right.
Okay, so here's the deal, Noah. I know we have to take a break here in just a minute. I'm going to ask you to stick around just for a couple minutes into our end of the hour here.
Sure.
So just stay with us. But all right. Now, I know that people are going to start, if anybody's enrolled in Medicare fee-for-service, they're going to start getting notifications in the mail.
That's
right?
correct. Oh, it is really important because I know I oftentimes go to my mailbox and take a look at things that look like form letters and throw them out. But if you are a Medicare beneficiary who's living with Alzheimer's disease or dementia, or you're caring for somebody, be on the lookout. Because if you live in Indiana and one of the service areas, especially Marion County and the areas around IU Health Hospitals or in the Fort Wayne area, you will likely be getting a letter, from Medicare that says, hey, there is a participating program, guide program in your area that you may be eligible for.
Okay, so, and that's hard because we're always on this show talking to people too about looking out for scams and, all of that.
Yes.
So no, this would be with the Medicare fee for service. It would talk about the guide model. If you have questions about it, then you need to reach out to that provider, right?
That is correct.
And confirm that this is indeed something. Don't just go sign up for something
Don't
online.
just go sign up for anything, and do not give any personal health information over the phone, because these programs know exactly what they should be asking you, and that information would not be scammable.
All right, we have to take a break. We'll be back here in just a moment.
You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you weekly by Joyce House in partnership with Cardon and Associates. We are here every week to bring you support, education, and hopefully a good laugh. Visit caregivercrossingradio.org to connect with us, hear past episodes, learn more about caregiver support resources in the community, and much more. That website again is caregivercrossingradio.org. Please don't go anywhere, and we'll be right back with more.
We're back on Caregiver Crossing. We've asked Dr. Nicole Fowler to stick around with us here for just a couple of minutes. Here's what I want to talk about. There is so much right now. I mean, President Biden last year put out an executive order saying that basically if we didn't get our acts together as a country, or if we don't, then we're going to be in a world of hurt. We know that for the first time in our nation's history, we're going to have more adults over the age of 65 than we will have kids under the age of 18 by 2030, which is like right here. We can almost touch it, And then in the state of Indiana, in surrounding states, there's just this huge spotlight on family caregiving right now. It is so exciting for those of us, Nicole, who have been in the business for so long, right? That we're like, yes, finally, the thing we've been screaming about, that if we don't take care of family caregivers and give them tools and education and support that they need, we're not doing the right thing. And it's really, I don't know about you, I feel overwhelmed right now.
Yeah.
Do you feel that?
No, I feel like there's so many things for caregivers. I mean, in addition to just trying to do the day-to-day stuff, managing all the different information about medical care and programs and services, in addition to taking care of themselves. And it is. And it's also exciting, though, too, in the sense, I think you recognize the fact that we all know that we've been in this spot for a while and not really talking much about it. but it is so hard to avoid it now, right?
It's so hard. You and I have been talking about it behind closed doors, not intentionally, but for years.
Yeah.
Right. And screaming for people to pay attention to family caregiving issues. And, what I do want to caution listeners is do be careful. This is a great time for scammers to come out and make those phone calls. And so you heard Dr. Fowler say earlier, don't give them personal health information. Don't make any kind of payment on anything over the phone, no banking, none of that.
Correct.
Let's be smart. And if you're confused, take something to the doctor.
Yeah, absolutely. We oftentimes, as part of our programs at IU School of Medicine, where we're doing research, with participants who are maybe going to their doctor in the next couple of days, we'll give them a call and ask them some questions. And we really want to make sure, and that they know that we are a legitimate call. So we do all the things that we can to ensure that. And sometimes people are still nervous and they say, well, I want to talk to my doctor first. Great. Good idea. You should do that. And then the doctor confirms, oh yeah, that call, they're working in our practice to help understand about who may need some more support for their memory and thinking. But we
Good
love
for
that.
them, right? For advocating for themselves and having some boundaries too.
Absolutely.
But, so what words in closing with you, I know you have a lot to do, and so we're going to let you go, but in closing with you today, what advice do you have in this wonderful, beautiful, caring, spinning world of caregiving right now? What advice do you have for family caregivers?
Yeah, I think that, it really is, as you mentioned, Tina, over the past, even just 5 years, the amount of attention on caregiving needs and issues in the state of Indiana and across the country, but also too some really innovative and exciting things like Guide, like we talked about earlier, also in sort of new treatments for Alzheimer's disease and new blood tests for detecting Alzheimer's disease. There's a lot of really exciting things that are happening both in the world of diagnostic, treatment, caregiving. I think, though, the big thing is that it could be overwhelming. And I think that caregivers just really being able to sort of take a deep breath and I think sometimes really reflect on what's important to them and their family. I've talked to so many patients who have come in and asked about the treatment, and then they learn about it. And then they learn about what it means as a family to have that treatment twice a month in the infusion center and all of the potential side effects. And they think, well, not really sure that this is for me. Being able to have those discussions, or somebody who comes in and says, yeah, I want to hear about the new treatments, or I'm interested in getting a blood test. Really, really thinking about what your values are as a patient and as a family and how that sets what your care plan is, I think is so crucial.
I love that. So lean into your family values. Don't be afraid to advocate, I'd say, for your loved one and for yourself. Mm-hmm. And you have to communicate. You have to communicate with your primary care and with the other people in your life. Good advice. Dr. Nicole Fowler, I'm so glad to have you here. We'll have you back sooner rather than later.
Thank you. I was so glad to be here today.
All right. So here's the deal. I want to, first of all, I just adore Nicole. I wish she could stay here all day long.
I do too. She was so much fun to talk to.
Yeah. And she's so smart.
She is very smart.
And just doing good work. But all right. So here's something I do want to talk about because, we mentioned that these Medicare, anybody who's getting Medicare fee for service is going to be getting these letters in the mail. And I don't want to give conflicting information because we also talk a lot on Caregiver Crossing about how often older adults are scammed. Mm-hmm. And it comes in a piece of mail, or it's an email, or it's a phone call. And so I want to just talk here in the last couple of minutes that we have together today about some ways you can tell if something is a scam. Okay. So if it starts with something like a generic greeting, like it starts with dear customer or dear madam or sir, like probably a
little
scam,
bit too vague.
Right. Yeah. If there's any broken English or typos in it, whether it's an email or it's a letter, probably a scam. There's no account with the sender. Like you don't have an account. You don't know what they're talking about. This is one that really makes me mad. It's the ones that come as a threat. If you don't respond to this within 24 hours, then
we have to take legal action
or
something like that. Yeah.
And I'm going to tell you right now, or if the email, by the way, says there's a fraud on your account, there's just a lot of stuff that can tip you off. And so make sure, we said it before, say it again, you're not giving out your personal health information. You're not giving out any kind of a credit card, number or anything of that nature. I want you to be very, very careful because it is hard to know what's real and what's a scam. I get confused.
I got confused the other day.
It happens, right?
It does.
So it's not just you. I don't want you to feel like you're I don't want you to feel less than because you get scammed or because you start to fall victim to it. Like,
because it happens to everybody.
It happens to everybody. So, all right, we have to go. It's been a great day with you. I hope you enjoy the rest of today. As we close the show, you can always email me at tina@joyshouse.org, or you can call us at 254, that's 317-254-0828. So tina@joyshouse.org, 317-254-0828. And we have some folks we want to thank.
Caregiver Crossing is supported by Cardon & Associates, with 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living experience. Cardon & Associates provides residents with the best senior living options and personalized service. Until next time, take good care of each other.